Hey everybody, my name is Dr. Scott Giacomucci. I'm a trauma therapist and trauma educator and a certified EMDR consultant. And in this video, I wanted to provide an overview of what to expect in an EMDR processing session. So this is a video that you might find useful if you're considering doing EMDR as a client and you're curious about what to expect, or if you're a therapist that's considering training in EMDR and you want more specific information on what EMDR processing session actually looks like, or maybe you're an EMDR therapist that did your EMDR training previously and you want a refresher on how to facilitate an EMDR processing session. So this video is made specifically for you. I want to really emphasize this video is not designed for you to try and do EMDR on yourself. Some people have had success doing that, and that's awesome and good for them. And many people really hurt themselves trying to do EMDR on themselves. So I really encourage you not to try to do that. At one point in time, about a third of all the clients I was working with on my caseload were clients who had hurt themselves trying to do EMDR on YouTube, or clients that did EMDR with other trauma therapists who maybe weren't trained well in EMDR or weren't implementing their training and ended up causing harm to their clients. So it's important that you don't use this unless you're trained to use it. This video is really just to familiarize you with the process and maybe provide some transparency and understanding of what to expect so that EMDR doesn't feel so scary to do. I also want to emphasize that this is an EMDR processing session that I'm going to outline. And EMDR processing is something we only do after we've already completed EMDR resourcing. So EMDR processing is focused on a specific traumatic memory. So this is not something you're going to get to until you're several weeks and sometimes several months into therapy with an EMDR practitioner. First, you're going to build a relationship with that person. You're going to identify coping skills and positive memories, and you're going to become familiar with bilateral stimulation and the EMDR process. Your therapist is going to do some memory mapping with you, which I just made another video about if you wanted to learn more about. And then you're going to identify a target memory. Once all of that has been completed, then we move into EMDR processing, which is what this video will be about. So you identify a target memory. Let's say we identify a target memory of a motorcycle accident. And this is the memory that we're going to process using EMDR. So this is how the process would go step by step. First, therapist is going to ask some questions. We're going to ask you to identify what that memory is. Maybe tell us as much as you're comfortable about that specific memory. We're going to provide you with some instructions. And sometimes the therapist is just going to read off the script because there is a script that goes along with EMDR. And other times the therapist is just they know the script, so they're going to use their own words and make it their own. If you're new in practicing EMDR, I encourage you to just read off the script. If you've been doing this for a while, I really encourage you not to read off the script and bring yourself, your personality into it. Translate the script for whatever client is in front of you. The script works. However, in some research, they also found that clients who had a negative experience with EMDR, one of the critiques they had was they felt like their therapist was just reading off a script and was not fully present with them. So I would encourage you not to do that once you get comfortable with the gist of it, the process. The script set tells us as the therapist to give the client these specific instructions. After each set of bilateral stimulation, which is either back and forth eye movements or bilateral sound or butterfly tapping, bilateral stimulation, or we sometimes use what's called a TheraTapper device, which has two little nodes that vibrate from one side to the other. So after each set of bilateral stimulation, I'll be doing a simple check-in about what you're experiencing. And I need to know from you exactly what is going on with as clear feedback as possible. Sometimes things will change in between sets, sometimes they won't. There are no supposed tos in this process. So just give an accurate feedback, as accurate as you can, as what's happening without judgment, whether it should be happening or not. Just let whatever happens happen. And then we're instructed to remind the client to create some sort of hand signal, usually something like this that means stop, but you can make it whatever you want. If you want it to be a peace sign or a thumbs down or really anything. Some sort of agreed upon hand signal that means pause. And this is designed to give the client some control, some autonomy, some empowerment throughout the process. If they're starting to feel really overwhelmed, that they can pause the process at any time and we can take a little bit of a break. So this is like a built-in safety structure. After providing those instructions, then we move on to the nature of the memory that we're working with. So we've got the presenting issue, we've got the memory, in this case, the motorcycle crash. Next question we're going to ask is, what picture represents the most disturbing part of this incident? Okay, and so the client identifies the most disturbing part of the motorcycle accident is a true motorcycle rider might say, the image of my motorcycle being destroyed. I know I was in a motorcycle accident 10 plus years ago, and that image still stands out in my head as the image of the motorcycle, less so, or more so than how I was actually hurt in the accident. So let's just go with that for this example because it'll be less disturbing as an example. The image of the mangled motorcycle itself is the worst image. Let's say that the client identifies that. Then the next question we'll ask, and we'll jot these answers down. When you think of that image right now, when you bring that image to mind, seeing that motorcycle on the street all mangled into pieces, what words best go with that image to express your negative belief about yourself now? And what we're asking for is not, what did you think back then when it happened? We're asking right now, when you think of that, what do you believe about yourself now? So let's say the client says, I believe I'm a failure. Then we say, all right, I'm a failure. We write that down. And we're really trying to get a belief about yourself, not a belief about the situation, not a belief about someone else. And we're really looking for a distorted belief, not an accurate belief. If the client said, my belief is that I could have died, that's an accurate belief, probably based on the situation. So we're not going to use that as the negative cognition for the memory. We're really looking for a maladaptive and distorted negative belief about ourselves. So I am blank is usually the structure of this negative belief. I'm a failure. Next, we're going to ask, when you bring up that image, what would you rather believe about yourself now? If we could just get rid of that negative belief that I'm a failure and we could replace it with something new and positive, what would you rather believe about yourself today? And let's say the client says, I want to believe that I am successful. Okay, we'll jot that down as the positive belief. Then we're going to move on to what's called the validity of the cognition, or the VOC. And we're going to ask, when you think of that picture now, the mangled motorcycle, how true do the words I'm successful feel to you right now on a scale of 1 to 7, where 1 feels completely false, 7 feels completely true? How true does that feel? I'm successful. So let's say the client says it feels like a 3. We jot that down, 3. Then we're going to ask about emotions. When you bring up that picture of the mangled motorcycle and the negative belief that I'm a failure, what emotions do you feel right now? And let's say the client says, I feel sad, I feel shameful, I feel guilty, I feel disappointed. We'll write those down. Then we're going to ask, on a scale of 0 to 10, when 0 is no disturbance or neutral, and 10 is the highest disturbance you can imagine, how disturbing does it feel right now to remember this memory and to think about this image? The motorcycle mangled on the street. And let's say the client says it's a 9 out of 10, all right? We're going to jot that down. And then we're going to say, where do you feel that in your body? Where's the disturbance in your body? And let's say the client says, I feel it in my gut. And we're going to write that down as well. So now we've just completed the EMDR session worksheet, basically the assessment of the memory, which is phase 3 of EMDR. So after we've assessed the target memory in the way I just described. Then we're going to move on to phase 4 of EMDR. This is desensitization. This is where we're going to apply one form of bilateral stimulation, which is either eye movements, audio, or tactile, with either butterfly tapping or the EMDR TheraTappers. And we're going to start to desensitize that memory. So what that looks like is we're going to say, I'd like for you to bring up that image, the picture that represents the worst of this memory, and the negative belief that I'm a failure. I want you to just notice where you're feeling it in your body and follow my fingers. And we're going to do some back and forth eye movements. We're going to do that for a handful of back and forth sets. Then we're going to say, take a breath. And what did you notice? And we're not looking for any specific answer. We're just looking for you truthfully, honestly, to let us know what you noticed. This is truly a free association component of EMDR. There is no right or wrong answer. You're just naming what you noticed during the eye movements. You might notice other memories that come to mind. You might notice other feelings. You might notice sensations in your body. You might notice belief systems. You might notice noise going on outside of the room. There's a whole range of things that you could notice. You just gotta tell the therapist exactly what you noticed. During the eye movements, what I noticed was that feeling in my gut, it got deeper and it feels heavier. Whatever you say, our response is gonna be great. Go with that. Focus on that now, that feeling in your gut, and follow my fingers. And we're gonna do another set of back and forth eye movements. And then we're gonna ask the same question. All right, take a breath. What did you notice that time? And you simply let us know what you noticed. Again, you might notice other feelings. You might notice other memories. You might notice sensations in your body. You just say what you noticed. Maybe that time you noticed you were focused on the feeling of disappointment in yourself. All right, now I want you to focus on that feeling of disappointment in yourself and follow my fingers. Just notice what you experience. No right or wrong. You're doing a great job. Just notice what you experience. Take a breath. All right, what'd you notice that time? And we're just going to keep doing this, essentially, until, as a therapist, we believe that whatever you noticed is no longer related to the memory we started with, or we are starting to run out of time, or we feel like you're getting stuck. Or, ideally, you say the same thing twice in a row. You say, I noticed the feeling of disappointment again. At that point, we're going to change things up because we're running into some sort of dead end, and we're going to come back to the target, which means we're going to say, all right, let's see where we're at now. You're doing great. Let's come back to where we started. Right now, when you think of that image we started with, that mangled motorcycle on the street and the negative belief that I'm a failure, 0 to 10, how disturbing does it feel to remember that right now? And client will just identify on that scale, 0 to 10. Usually at this point, the disturbance of the memory is already reducing. So let's say the client says it's a 7 out of 10 now. Earlier it was a 9, now it's a 7. We're going to say, great, we're already making progress. Right now, what's the most disturbing part of it? Is it still the image? Is it the belief? Is it the sensation in your body? What is it? What's the most disturbing part? All right, whatever you say, we're going to say, all right, focus on that and follow my fingers. And we're going to go right back into another set of bilateral stimulation. And we're going to ask the same thing at the end of it. Take a breath. What did you notice that time? Client says whatever they noticed. We say, great, focus on that and follow my fingers. And we keep going. What did you notice? All right, focus on that, follow my fingers. And we're just going to keep going until things start to really shift or until we hit another dead end, in which case we're going to come back to the target and see what other channels connected to that memory need to be desensitized and reprocessed. So each set of bilateral stimulation is really only like 10 to 30 seconds long. So we're breaking this memory up into bite-sized chunks, tolerable pieces, so that we're not going to overwhelm the client. Often, what will happen at some point is the client will start to spontaneously notice something positive, something adaptive, or they'll start to notice things change. Oftentimes it happens without any intervention from the therapist, although sometimes as the EMDR therapist, we might need to be more active. And we might need to use other techniques and skills such as interweaves or other somatic interventions, or we might use parts work, or we might use other visualizations in the EMDR processing session. We might ask you to focus on something specific. Would the average person believe that you're a failure because you crashed your motorcycle? Focus on that and follow my fingers. That would be an example of a cognitive interweave. Or we might use a somatic intervention. Oh, you said you're feeling some tension in your stomach right now? I want you to follow my fingers, but breathe really deeply into your stomach and tense the muscles in your stomach, and then really release and exaggerate the release, and do that a couple times as you follow my fingers. That might be another advanced somatic intervention we might use. So as a therapist, it's best that we're as least involved as possible to really emphasize that the client is doing the healing and the client's mind and brain is healing itself. It's not us providing healing. However, if we're running out of time, or it feels like we're getting stuck, or it looks like the client's becoming overwhelmed, then we might be more active in offering more active interventions like the ones I just described. Another thing we might do is bring in different guided visualizations into the process. We might say, oh, you crashed your motorcycle when you were 20 years old and now you're 40 years old and you have a new perspective on life. I want you to imagine you today as a 40-year-old adult showing up in that memory and speaking to your 20-year-old self, offering yourself some perspective, some validation, some comfort, and see what happens. Follow my fingers as you do that. So we might do something more visual in that way. Basically, that's what the bulk of the EMDR session is going to look like. Most of the time, you're going to be following the therapist's fingers or closing your eyes and holding the EMDR TheraTappers or self-tapping. And your therapist is mostly going to be quiet while that's happening and check in with you and notice what you experience. When your therapist checks in with you about that, you really just want to be honest and try to be brief. You don't want to go into a whole story because then you're disrupting the EMDR process. You just want to, in 1 to 3 sentences, very briefly, simply name what you experienced. So we're going to keep going with that process, returning to the target occasionally, checking in on the disturbance level until we run out of time, in which case we're going to contain things. We're going to revisit one of the coping skills or EMDR resources that we created earlier to contain the session, because it's an incomplete processing session. And then in the next session, we'll pick up where we left off. Or we'll continue that process until we get the disturbance on the memory down to a 0. Now, hearing this, it might feel like that sounds impossible. You'll never get the disturbance of a memory down to a 0. And that was what I thought too when I was first introduced to EMDR. But I have been amazed at how effective EMDR is consistently, that I've come to expect most of the time I do an EMDR processing session, the memory drops down to a 0 and the client says, wow, I can think of that memory right now with no disturbance. It just feels like another thing, another memory, like any other memory. I feel neutral about it and neutral towards it. We're not going to forget the memory, but we can change your relationship to the memory. So if we've gotten down to a 0, then we move on to the next phase of EMDR. So this would be phase 5, and this is called installation. This is where we're trying to link the positive belief we talked about earlier to whatever remains of the original traumatic memory. So in the installation phase, we're going to repeat back the positive belief that was identified earlier. Do the words, I am successful, still fit when you think about this motorcycle accident? Or is there a different positive belief that feels more congruent or more fitting? And whatever the client says, we go with that. If they say, yep, that belief feels pretty valid, or maybe they say something else, they identify a different positive belief, in which case we'll just change it. And we're going to ask the client to think about whatever remains of the original memory and to repeat the positive belief to themselves. I am successful. I am successful. I am successful. And as they're thinking of the image from the trauma and the positive belief, I'm successful, we're going to ask them on a scale of 1 to 7, how true does this positive belief feel now? And let's say that they say, all right, it's a 5 out of 7 now. 7 being completely true, 1 being completely false. Then we're going to strengthen the connection. So what we're going to do is strengthen the connection through eye movements or whatever form of bilateral stimulation. We're going to say, focus on that positive belief. I am a success. I am a success. And at the same time, focus on that image from the memory of the mangled motorcycle and follow my fingers. And we're going to then check in, say, what'd you notice that time? And we're just going to keep going as we strengthen the connection between this positive belief and the traumatic memory. Basically, what we're trying to get to is a validity of cognition score of a 7 out of 7. So we're going to check in each time. Now, how true does that belief feel to you? 1 to 7. So once we get to a 7, then we would move on to the next point. However, if we don't get to a 7, then we're going to check in and say, what is it that's preventing us from getting to a 7 out of 7? And there might be something for us to work on that's blocking the process. Next, we move on to phase 6, which is the body scan. And this is essentially where we're going to invite the client to call to mind whatever remains of that memory we started with, and to take a moment and scan their body, check in with their body from head to toe, and just let us know if they notice anything. If the client notices any disturbance during this body scan, then we're going to use some eye movements or bilateral stimulation. All right, focus on that sensation that you noticed in your hands and just notice what you experience as you follow my fingers. And we're going to try to desensitize anything else that remains in the body attached to this memory. Once we can engage in a body scan while remembering the memory and having the positive belief attached to it without any disturbance somatically or physiologically, then we move on to phase 7, which is closure. And this is essentially where we're just going to wrap things up. We're going to celebrate the client for the awesome job that they did. We're going to offer some reminders about taking care of yourself in between sessions, and that it would be common to have dreams or other memories or thoughts related to this. We're going to remind the client of their coping skills and supports, and to jot down and write down anything that they notice in between sessions related to the memory. And then we're going to check in and say, how was that? What did you notice? Anything feel important to talk about related to what just happened? And then we're just kind of debriefing the experience. So this is phase 7, closure. That's an EMDR processing session. I mean, that's what it is, essentially. Of course, the content is going to look different for every memory. Like the example I used today was the motorcycle accident. And each client is going to have different images and beliefs and feelings and sensations, and it's going to be a different process for each person. But essentially, that's what an EMDR processing session is going to look like, no matter who the therapist is or what the memory is. Now, there's modified approaches to EMDR. So some approaches are going to involve coming back to the original memory much more frequently. Like if we're doing what we call EMD little r, or EMD, desensitization without the reprocessing, then we're going to just come back to the target after each set of bilateral stimulation, rather than saying go with that and notice what you experience. But generally speaking, what I just described to you and walked you through is the basic protocol of an EMDR processing session. So I hope that this video is helpful and helps kind of demystify what EMDR processing is and looks like. I hope that this makes it feel a little less intimidating if you're a client considering doing EMDR. And I hope that this increases your sense of confidence and familiarity in the process if you're a therapist recently trained in EMDR and preparing to use it with a client. And if you're a professional considering training in EMDR, I hope that this provides some helpful information to help you in your discernment process on whether or not to get trained in EMDR. If you wanted to learn more about EMDR, I'd encourage you to check out some of the other videos on this channel. Feel free to leave a comment below about what you learned, or if you have questions or anything that was helpful for you in this video, and check out some of the other videos. Thank you.